Hi, I'm Dr. Sarah Wasserbauer, and today we're going to talk a little bit about the latest media, which always, there's always some new clickbait on here, and the latest media on finasteride and its effect on men and the side effects. So the Wall Street Journal recently came out with an article, and one thing I have to agree with on this article is that if you're going to be getting a medication that's a prescription, you should see your doctor or talk with your medical professional who knows you, that you're part of their practice in order to get these medications because side effects can happen. Now, that being said, if you're really worried about side effects, you could use a topical formulation of finasteride, but not just any topical finasteride formulation because not all of them are the same. Some topical formulations actually give you higher systemic levels than the oral formulation, which is what people are usually trying to avoid by going on topicals in the first place. So you got to be careful. Not all topicals are alike. If you're really interested, you should look up the data on solid lipid nanoparticles and nanolipid formulations. These are kind of the new big thing in dermatology and in getting medications into skin and absorbed by the skin in an area where you don't want them to be whisked away by the blood vessels, and you also still want them to be able to penetrate. So the only one currently available is made by an outfit called XYON, XYON. It's made by a compounding pharmacy. It is available here in the United States. They're kind of small now, but that's the one that I have the most data on. And what you want it to do is you want it to be able to penetrate into the scalp, but you don't want it to get the blood vessels so that it gets whisked away to your liver and gets converted into inactive metabolites. Because that doesn't do anybody any good, and then you would still get the side effects. So you want it to actually stay in the tissue and slowly kind of be percolating into the hair follicle over time. The other point to make about having side effects on oral finasteride is that these things are usually dose dependent. So if you have a doctor who really understands how to dose finasteride, you could try 0.5 milligram a day, 5 milligrams once a week. And these dosing regimens usually have almost no side effect profile, even for people who've had any kind of increase or decrease in their libido. And that's what it is. It's a libido increase or decrease. If you have that kind of effect, well, then you just change the dosing, and that's how you get rid of it. Same thing with minoxidil. If you're taking oral minoxidil, it's lowering your blood pressure. The cardiovascular effects are at this blood level, but you can still not have those and still have hair effects at a much lower level. So you just lower the dose or, change the timing of your dosing. So it's very clear that what people need to do is to see their doctor. And if they have side effects, use their doctor's knowledge to adjust that. Maybe even try a topical that actually gets in there. The last thing I wanted to say, besides see a doctor for your hair loss, is make sure that your doctor actually knows what they're talking about with hair. Sometimes you go to a dermatologist or a plastic surgeon or even just your general practitioner, because I was a general practitioner, and they may not be up on the latest with hair. If you want to find a good hair doctor, look for somebody who's a member of the International Society of Hair Restoration Surgery, who's board certified by the American Board of Hair Restoration Surgery. They're also the International Board of Hair Restoration Surgery, or are part, if you're in a different part of the world, are part of the Global Council of Hair Restoration Surgeons. And the reason I say this is because not everybody is out for your best interest. Some people are out there to just take advantage of patients and make money. You kind of knew that, otherwise you wouldn't be tuning into this podcast. I hope that helps.